Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. Doug Collins, the VA Secretary. He's got a lot on his plate. Obviously, there are some big ticket items that he's working on and it has got to be a focus for him, such as the electronic health record and really the budget of the VA with all of the calamities over the last fiscal year with regard to budget and forecasting. However, there are some other things that he is focused on, and I wanted to touch on that in an article that I found. Before we jump into it, though, I want to throw on a special thank you to Paul Lunks 8383. Paul, thank you so much for that super comment, super chat. I really do appreciate your support so very much. Thank you, Paul. All right, so this is an article that I found on military.com talking about some of the pledges that the VA Secretary made as he was a nominee at that point, but he is now the VA Secretary. And I wanted to go into that. Please hit the thumbs up, subscribe, share with a friend, all that good stuff. I truly appreciate it. Every thumbs up and every minute watched helps to share this information, which we all should be aware of. So thank you so much for doing that, hitting the thumbs up and subscribing if you haven't, and letting the video run. If you want to support the channel in other ways, consider being a member. Thank you so much to all you members. All right, now, VA Secretary nominee at the time, now the VA Secretary, pledges to modernize health for veterans through hospital infrastructure and promote community care. Doug Collins, President Donald Trump's nominee for Secretary of Veterans Affairs, who is now in place as the Secretary, pledged to preserve the VA's healthcare system, but also improve medical services for veterans through community care and other programs, which is exactly what I've been saying is going to happen. We can't pull back on community care and only focus on the VA's ability to provide care. And we can't just focus on community care and disregard the VA's healthcare system. It's got to be a hybrid approach, and we have to look at bolstering it up on both ends. We must meet veterans where they are, quite literally. And in some cases, veterans have to travel way too far to make it to a medical facility by the VA that can actually service them for the issues that they have. Therefore, it is much more appropriate to provide robust community care for veterans. So let's dive into it here and see what they say. Collins, an Air Force Reserve chaplain and former Republican congressman from Georgia, told members of the Senate Veterans House Committee, the Senate Veterans Affairs Committee, the Senate Veterans Affairs Committee on Tuesday, which was when he was going through the hearing, that there will always be a VA healthcare system for the veteran, period. With community care providing specialty care and treatment for veterans who don't have ready access to a VA facility. Makes sense to me. At the same time, Collins added, the department needs to modernize the system for veterans who deserve every access to finding care where they can, which I agree. Now, one of the things that has kind of changed over the, I don't know when, it's several years, is the VA started to allow telehealth as an approved method to divert from community care availability. Meaning that you could call into the VA, they could say, well, your in-person appointment is way outside the time frame. That alone would qualify you for community care. However, we do have an opening for telehealth, and that's tomorrow. So you don't get community care. You have to either take this telehealth call or just wait till your other appointment, because we've provided you with a viable, in their opinion, viable option for your healthcare needs, which personally I don't agree with. I don't think that telehealth should constitute adequate healthcare to divert from community care for a veteran in need. That's just me. All right, moving on. So hopefully, in my opinion, I'm hoping we reel that back, because I don't think that that is advantageous for the veteran. All right, moving on. There's a quotation. We're going to fight for a strong VA, Collins said during his confirmation hearing. I believe you can have a strong VA as it currently exists and have a community care aspect. Questions have loomed over the size of the VA's community care program since it was expanded under the Mission Act of 2018. Currently, 42% of medical care provided by the VA to veterans is done by the private sector. raising concerns that the cost is undermining the department's budget for in-house treatment. The rising costs of community care in the past few years have spawned debate over veterans' access to private care, with Democrats largely seeking to strengthen the VA's medical infrastructure and staff. And I'll tell you, I'm going to stop there for a minute. At least as far as I've been aware, in the different locations that have staffing shortfalls, especially when it comes to medical professionals, a lot of it has to do with location, the cost of living, the amount that the VA is willing to pay. All of those things come into play for hiring and retaining medical professionals. If they can go work across the street and make 50% more, why wouldn't they? All right, moving on. So it says here that that they're largely seeking to strengthen the VA's medical infrastructure and staff, which they say are less expensive and provide better care for veterans' unique needs, compared with Republicans who believe the VA should provide quality in-house care, but also allow veterans to choose who they want to see, especially if the VA can't accommodate them in a timely fashion or with specialty care. Collins said he supports the community care program as well as VA medical centers that veterans can come home to with improved communications between civilian and government providers. Through an overhauled electronic health, so the healthcare record system, right? So the EHR, electronic health record system, which is a big ticket on the plate. The VA's adoption of the federal electronic health record system, a $16 billion with a B billion-dollar project that was supposed to be completed by 2028, but is used at only 6 VA medical facilities, has been on hold for nearly 2 years as a result of safety concerns. So that's going to be a big issue. There has been calls to just scrap the whole thing and start over. So I'm curious to see where this ends up with the electronic healthcare record. Or the electronic health record. Moving on, we're looking forward to the project review. Collins said, "I'm putting on notice today that I am committed to everyone here. We're going to bring everyone to the table. That's the vendor, that's the VA, everybody in the middle, and figure out what the problem is because it's time to fix it." Collins faced tough questions on female veterans' access to care, including abortions, and replied by saying he would adhere to the law, citing the 1992 Veterans Health Care Act, which specifically forbids the VA from doing abortions. Senator Hirano from Hawaii noted that the VA published an interim rule shortly after 2022 ruling by the U.S. Supreme Court overturning national protections for abortion, Dobbs versus Jackson Women's Health Organization, to provide abortion counseling and procedures in the case of rape, incest, or when the life or health of a veteran is in danger. Collins said that the department would look at the rule and determine whether it complies with the law. It's a debatable issue, he said. According to a VA report to Congress in October 2023, the department provided 88 abortions in the first year it offered the procedure. The Senate Veterans Affairs Committee is set to vote on Collins' nomination Thursday, which has now hit, and he is in as the Secretary of the VA. So that is done. With that, I just wanted to roll this out to you, let you know basically that, some of the top things that we're looking at here from the VA is electronic health record, budget, which they didn't really talk about in here, but we all know that the budget is a huge issue. So electronic health record, budget, internal infrastructure of the VA healthcare system, and community care access for veterans. With that, thanks so much for watching. I appreciate you. Have a great one. And remember, if we don't take care of each other, something went wrong.